Darkcast Network. Welcome to the dark side of podcasts.
When you have a traumatic event, it's not the facts that are going to haunt you, it's the images. What if we can keep the knowledge, but we lose the pain? Stay tuned. Welcome back to True Crime Connections. My name is Tiffany and I am your host. And today we are talking about art therapy, but it's not the art that you are thinking about. So joining me today is my guest, psychotherapist Brooke Bralove. It's very nice to have you.
Thanks for having me on.
Absolutely. This is so interesting reading about all the different things that this art therapy has to offer, and that's accelerated resolution therapy.
Yes, not the art therapy like markers and paints. And some people call it art and some people call it ART. So either way is fine.
I was just blown away because I mean, this deals with things that everybody deals with in a sense: anxiety, physical abuse, sexual abuse, domestic violence, trauma, parenting issues, self-esteem, postpartum depression. I mean, this is impressive.
Yeah, I mean, we've really kind of realized that art works on almost any issue that would bring you to regular talk therapy. And so it's known to be a trauma therapy, a therapy like specifically to address trauma and PTSD. But I have worked on countless number of things. I mean, I've worked on, public speaking and writer's block and fear of flying, dog phobia, OCD, feeling stuck in your life, breakups, really anything that would bring you to therapy, art really can help with it.
I mean, that just crossed off about 90% of people out there.
Yes. And obviously the big ones are also, depression and anxiety, and things like that. But, it is really the sweet spot, and the way art began is for, kind of single incident trauma. And so I find that accelerated resolution therapy works beautifully, but for single incident trauma, I can usually help somebody in sometimes just one session, maybe two. But single incident trauma really requires not much processing at all, because it's such a specific, had a beginning, had a middle, had an end. And most people are very motivated to get rid of single incident trauma. So I have a ton of success with sexual assault survivors because, to say the least, they are very motivated to get rid of those images. And that's really what, art is. So it might be helpful for your listeners for me to just kind of work backward a little bit and just tell you what art actually is.
Absolutely.
So, art is an evidence based treatment modality that uses rapid eye movement and voluntary image replacement to change the way the brain stores distressing images and then any corresponding negative sensations that come up in the body. And so, in as few as 1 to 5 sessions, we can really help people let go of those images that, can haunt them for years and years. And specifically, what I really like to tell people is, people don't want to be triggered. They don't, the Vietnam vet does not want to be at the car wash and hear a car backfire and jump through the roof and get sweaty and panicky and hit the deck. They don't want that. So what art can really help with is making sure you don't get triggered anymore by changing images, replacing them with positive images that the client themselves, come up with. And then we store those in the brain. And so we know that bilateral eye movements, also used in EMDR, are very calming. And so if you pair calming eye movements with desensitization of a scene, you're going to help the nervous system regulate. And then while the nervous system is calm and regulated, you replace the images. And truly, I mean, this happens so many times, I really can't even count anymore, that, someone will be imagining a scene. Like I had a woman imagining a sexual assault, meaning replaying it in her mind. And, she was like, I can see him standing over me. And then within a few minutes of doing the protocol, it's a very scripted protocol, she actually could not even see him in the scene anymore. She couldn't see him. So we really don't need these images to haunt us. You'll never forget the facts. So we say in art, keep the knowledge, lose the pain. You will never forget the, exact facts of what happened to you, and you will always be able to report them. But we don't need you to become dysregulated when you're reporting them, or get triggered by, when someone comes up behind you to give you a hug. You don't want that when you're in a loving, caring relationship. But when that happens, you flinch and get, go into a trauma response. We don't need that. We don't want that. But you will always have the facts of what happened to you.
Right. Well, that's embedded in your brain for the most part.
Right. But the images don't help you at all. You don't need them. That's what contributes to the suffering, not the facts. And, the more we learn about trauma, we realize it's not what happened to you. It's the images that you're stuck with, and it's the nervous system dysregulation that you then carry with you, and often, get re-traumatized. But the actual facts of what happened are usually less traumatic than the feelings that remain in your body, right? And so we know, for instance, sexual abuse, often it is not the actual sexual abuse that is the most harming. It's the shame that the child has and carries with them throughout their life. That's what's causing the most pain and impacting them negatively, not the facts of what happened to them.
So if a person comes and sees you as an adult and this happened to them in childhood, do you take them back to childhood, or do you start from where they are now?
Well, it's a good question. It really depends what's bringing them in. So if someone comes in and says, I keep having flashbacks. It happened 30 years ago, but I have flashbacks. It's kept me from being in a relationship, and I can't get rid of the flashbacks or the nightmares. Then we'll start 100% back in childhood and get rid of those images to, help them not have those flashbacks and nightmares. But if someone comes in and says, when my partner touches me, I flinch, he can't even hug me anymore, I haven't had a romantic relationship, I'm avoidant, then we might start in the present. But there is no doubt that we will probably still end up needing to process the past. So I usually give the client the choice about where they want to start. And most people are motivated by what's happening today. So they say, well, I don't want to, I want to have a healthy sex life. They don't necessarily say, I want to, not have those images. And so we would start there, but there's no doubt you're going to have to go back eventually. I mean, this is sort of, I always say, like, spoiler alert, it's about your childhood, about talk therapy. So also, spoiler alert about art, often it's about your childhood. And what is so amazing about art is the brain makes connections using the bilateral stimulation that it would never make if you were just talking. So, for example, I had a woman who had severe pelvic pain, really, really, like, couldn't even sit, couldn't cross her legs, couldn't wear, specific pants for like 6 years. And in the intake, I realized that she had some physical abuse as a child, which she really wasn't even had not even been validated for her that it was actually abuse, because culturally she thought that was normal and that kind of thing, but it was, very clearly not, right? Humiliation, beatings for no reason, things like that. So she comes in for her pelvic pain. But what I found is that when we worked on the physical abuse, her pelvic pain went away. And you can't make that shit up. I hope I can curse.
Oh,
You
of
can't make
course.
that shit up, you can't script that. It just happens. And when it happens, it's so beautiful that somebody is making a past and present connection that there's no way they ever would have made, because the brain is looking to heal. And you often developed these ways of holding your body based on childhood trauma. So I would say to her, your pelvic floor learned that it had to tighten to protect yourself as you were trying not to be beaten by your mother. And that's what's still going on in your body. So we change this images, we make her feel safe, we make her feel powerful, and she gets to create this, right? I make suggestions maybe on some things she might want to do, but at the end of the day, it's up to her to heal herself. I'm just a guide. And then her pelvic pain went away.
That's
And in some
amazing.
way, yeah, and in some ways, I mean, it just feels like a miracle sometimes what happens in my office. Truly a miracle.
Oh, I bet it is absolutely beautiful to watch. When
It
somebody
really
comes
is. And
in
yeah.
and is like, I can't do X, Y, and Z, and then they leave and they're a completely different person.
Yeah, and I mean that's how people describe it. I'm free, I'm unburdened, I'm hopeful. And again, I mean in the matter of 90 minutes, sometimes 60. They come in, I'm anxious, I'm, hopeless, fearful, depressed, sad, and then at the end, again, mostly all positive things that they would never have believed they could ever feel, let alone after 90 minutes. And I see it time and time and time again. So there's no doubt in my mind about how powerful this tool is. And I think it's so important when you're trying to provide hope for people, because I've been a talk therapist for over 20 years. I love talk therapy. I love being a witness to my patients for, long periods of time and helping them. But at a certain point, I don't want you to keep coming. I want you to get better and go live your life. And with art, I can do that. And I can help, 5 times as many people because I'm only seeing people for 1 to 5 sessions versus years on end. And especially too for other therapists, if you're stuck with somebody, find an art therapist. If you have somebody who just cannot get over this one thing, send them to art. They'll come right back to you, but send them to art to get unstuck about this one thing. Because talking ad nauseum about your trauma does not help. In fact, it can often re-traumatize you, because every time you tell it, it actually worsens in your mind. And I want to be clear, I am not saying that talking about things that have happened to you is not incredibly important because of witnessing and voice and truth telling. But I mean that if you aren't getting better, go do a different type of therapy. Do EMDR, do tapping, do brain spotting, do art, and find someone who can help you in a different way. Because the bottom line is all the research is showing that it's the brain and the body that matter. We have to change the nervous system to change the brain.
Oh, I completely agree with that. Just like, the book, The Body Keeps the Score. Your body does not forget. You might think that you pushed it out of your mind and I'm great, but your body is still fighting on the inside.
Yeah, that's right.
How is art different than EDMR? No, EMDR. Yeah, EMDR.
It's different in several ways. One, EMDR uses or focuses on thoughts and feelings, and art focuses on images and sensations. EMDR is a little bit meandering, meaning you sort of follow the client wherever they go in the session. Art has a very clear protocol that always has a resolution at the end of every session. So you don't leave things open-ended. It doesn't mean you're cured by the end of every session, but you have a resolution. And so people literally 99% of the time feel better. I have only had one session where someone felt worse, and I've been doing this for 5 years. No, 6 years. Yeah. So, and then in terms of EMDR, often will use either tapping, sort of tappers in someone's hand, or beats in someone's ear, and not necessarily eye movements. With art, it really is the eye movements that are most beneficial. And EMDR can be more about sort of how to live with the problem or the trauma. And with art, we really don't think you need to live with it at all, because again, you don't need it. You only need the facts. So it's not really about like integrating something. It's about moving beyond it so that it does not impact you anymore. And yeah, so those are the main differences. EMDR is great, but I'm trained in art and that's what I love.
Right. It sounds amazing. Now, is there lights associated with this since it is more of a visual thing?
So when we're trained in art, we're trained using our hand, meaning you just move your hand back and forth. I use a light bar for in-person sessions because I like to track the patient and watch them very closely. And I find that, you know, moving my hand back and forth really gets in the way of me really paying attention to them and what I'm seeing on their face and in their body language. But you can do it any way that, would allow the person to move their eyes back and forth. And when I do it virtually, there's a program I use that just has a little blue dot that goes back and forth, and the client just watches that. And they are equally effective in person and virtual, which is extraordinary. And I prefer inpatient regular psychotherapy, talk therapy, but actually for art, I don't have a preference. I really like them both. And I've had patients who've done both in person and virtual, and they sort of agree they don't really have a preference, except if, it saved them an hour in traffic or something.
Right. Well, very interesting. I mean, it seems like it can literally help with so many of today's troubles. Everybody has gone through some kind of trauma in their life, especially by the time you hit a certain age. Like,
Right. And even if you don't identify as trauma, like if you are someone who, every time your mother calls and you hear her ring, you get, anxious and fearful and go into, some, altered states, so to speak. Art can help with that. You want to have a different response, art can help with that. And, it improves, relationships. I mean, I've heard back from people that are like, God, I have such a different relationship with, my son-in-law, and my whole family can see because we worked on that for one session.
It's amazing that one session can really give people relief.
Yeah, and again,
That's amazing.
especially single incident trauma, I mean, often it's one and done, maybe two.
Wow. I
And I'm
see you
talking
also
about
do.
people who are like, I'm sorry, I'm talking about people who like are not functioning. Like I had a person who'd been, held up at gunpoint while walking, around their block and couldn't leave the house, couldn't go to work, shaking, crying, unable to focus, nightmares, no sleeping. He came in for 2 sessions and he was literally as good as new. And it had happened like 3 weeks before.
Wow. That's amazing. But I saw you, it also helps with phobias. So if somebody's like scared of snakes or heights or like you said, fear of flying, this helps.
Yeah, it works really well for fear of flying. I had a great um, experience with someone who, again, had, avoided flying. They just weren't willing to fly anymore. And it obviously has a pretty negative impact on your life if you're never willing to get on an airplane. And, there had been one time where there had been, terrible turbulence, and that led them to just be completely phobic. And I think we had to do 3 sessions. That was a little bit more challenging. But, you know, I remember saying to the person, well, why don't you make it like you're in first class and, Beyonce sits down next to you and you spend the whole time chatting with her? And why don't you use that and replace the old scene with that? And I will tell you, Beyonce has made a few appearances in people's, better scenes, which is very funny. So, Lord of the Rings has also been um, a metaphor that is used a lot when people are creating these better versions of their original, kind of experience, which I always find really funny. I'm not a Lord of the Rings fan, but I kind of feel like I need to see it again just so I understand why it keeps popping up.
I would think that would be a weird one though, because there's like so much craziness going on in those movies. Like, how is that your safe space?
Well, again, I just don't know enough about it, but I think people find those characters very comforting, some of them, and imparting wisdom and healing and that kind of thing. So, but it's amazing what people come up with. I mean, my favorite story is the guy who I worked with who had very low self-confidence, and he said, I want to feel better about myself. I want to be a writer, but I'm not confident enough to put anything out there. And in his, better version of a scene, he imagined himself as a Beatle during Beatlemania. And let me tell you, he had, a grin from ear to ear on his face. And that's really, I know, that's my clue for that this person is healing in front of me. I look for the smile and I don't stop until I see it. And sometimes people will say, well, that's good enough. It's fine. I feel pretty good. And I'm like, nope, I didn't see a smile. I don't say that to them, but in my mind, I'm going to keep going, even if it takes multiple sessions, to try to actually see their healing on their face. And when I do, I mean, it's literally the best feeling. And for those of us, who do talk therapy, look, some of it is long and hard. I love it, but this is also something that really is preventing burnout for me. And that's why I really encourage therapists to get trained in art, because you don't have to sit there and hear about trauma ad nauseum. Because in art, there's very little talking. I speak to people about why they're coming in their intake session. And then frankly, they never need to tell me any more details ever about what happened to them. I don't need it. They don't need to say it. And sometimes, I've had a person come in who said, I'm not going to tell you anything. Um, all I need you to know is I'm working through a sexual assault. And I said, okay. I knew nothing else, and I still was able to help them because I don't need content. I just need to facilitate the protocol for them.
That's interesting in itself, though, because usually you have to dive in deep to the details. So I could see where that could be more liberating for people as well, because they don't have to go to that place.
Well, exactly. And they've often, I'm often a last resort for people, right? It's not usually, I am not the first stop in somebody's therapeutic journey. They don't start with art, they start with all sorts of other things. And so by the time they get to me, they don't want to keep talking about it. They've told their story so many times. It hasn't helped. It hasn't gotten them unstuck. And so that's one of the beautiful things. And that's why it also, often works really well for children, because children often don't have the language to talk about trauma, but they do have images inside their heads that they don't want, right? And often we see this as nightmares, right? They're not saying I'm having flashbacks. They wake up and, screaming from a nightmare. And so they don't need to tell us using language all the time what's going on, but they need to kind of see the images or think about the images in their head. And then maybe they'll say, my tummy hurts, or I feel like I'm choking. And those are the kind of sensations that often come up around trauma, right? Lump in the throat, nauseated, chest tightness, numbness, all those sensations. And when we slowly improve those with the bilateral eye movements, then we can replace them, and the person walks away with not only good images, but a regulated nervous system.
Which is so important. Let me tell you, so many nervous system problems come from undealt trauma, I mean, IBS, autoimmune disease, it just goes on, and it's
Yeah,
very
and
common.
absolutely very common. And art works for lots of health issues. I see, chronic pain, chronic illness. And again, a lot of chronic pain, as you said, is, kind of stuffed feelings or traumatic experiences that, as you said, get stored in the body. And so, just like any other trauma, we have to go back to the trauma. They think they need to treat the illness, but it's less about treating the illness itself. And more about treating the trauma. I am not saying they don't often have an illness, right? But there's often a psychological, part of it. I also treat a lot of medical trauma, a lot of women who've, been not been believed for their pain. So a lot of people with chronic illness also just have this medical trauma, from people telling them it's all in your head. And so I work a lot with that too. Birth trauma. I had a wonderful experience with a woman who had an 11-year-old and still could not let go of the birth trauma. And 2 sessions, and she says now when she thinks about her son's birth, she only sees this beautiful scene she created in her mind, and she's not tortured in any way, shape, or form anymore. The brain doesn't need it to be real. It just wants a good story to hold on to.
I like that. It's rewriting your past in a
Yep.
sense.
It's
The way you
rescripting
want
it.
it.
Right.
Yeah.
And that doesn't make you not understand reality. I think people get really like, that's not possible. I can't do that. That's changing facts. There's nothing about this that's hypnosis. We're not trying to, you know, change anything other than how it exists in your brain and body. That's what we need to change, not anything else.
Well, those are what keeps it the longest. So, yeah.
Right, exactly.
I also saw, so this can help you learn new things as well.
Let's pause. I don't actually know what you mean by that.
I could have sworn it said it can help you develop new skills, but maybe it's like coping mechanism skills.
Yeah, I don't want to, I'm not, I want to try to understand that question.
Because it
Do
said
you think it,
you can help recognize and alter patterns in your life, develop new skills to enhance your relationship and family with friends. So yeah, apparently it's just maybe reading enough.
well, yeah, I guess I sort of feel like more like it'll help you respond differently um, to things that have been problematic in the past. And once you see that you can respond differently, you then do change patterns moving forward.
Right, right. That makes total sense. You
Yeah.
don't repeat the bad ones that we seem to do.
No, because you finally realize you have other choices and you have a better outcome. And so you don't go back and rely. But we never try anything new because we're so terrified. But if you see in your mind's eye during an art session that that new thing will work, then you are much more likely to try it out. And often it does work.
Right. So it kind of takes away some of the fear that holds you back in a sense as well.
I think so for sure. And also, I've seen people make decisions using art. Because again, when the left and the right brain talk to each other, you're using the creative part and the problem solving part, and they get to meet in a way that doesn't always happen in our regular day to day, comings and goings. And so I had a woman come in and she's like, I just had this horrible experience with, my boss, and I literally have no idea what I'm supposed to do. This is just awful. She was so dysregulated. Well, first of all, in 20 minutes, we had her completely regulated. And then I said, so, what do you think you should do? And, one set of eye movements, she's like, oh, I know exactly what I'm going to do. I'm going to, call his boss and tell him that, we need to do X. And then she was like, okay, I'll see you next time. It was just so easy for her to figure out. But again, she was so dysregulated. She could not problem solve. And so, okay, this just happened yesterday. And this was honestly shocking to me, even. And I'm not shocked by a lot because it's so magical. I just kind of am like, oh, yeah, that's a regular day. I see magic all the time. But I had a woman who had been involved in a war in another, she had grown up in a war zone. And she had one of the most traumatic experiences with a young friend who had died moments after they had been playing together by being blown up in a bus. And this was, horrific and horrible. And she was 5 years old, and now she's, 35. And those images, to say the least, were still there. Well, we worked on it, and we had a very beautiful session. And at one point I said, I'm so sorry, I don't remember the little girl's name. And she said, Brooke, I don't remember her name. I have tried over and over again to think of it, but I don't know what it was. I said, do you want to know? And she said, yes. I said, okay. And we did a set of eye movements, and she stopped and she said, her name was Rachel. Just like that, clear as day, 30 years later. She had not remembered it, and only through art could she open up her mind enough that it just came to her. And it was just incredible. It was beautiful.
Wow. She remembered the event, but not the girl in particular, not the name, not.
Nope,
That's
not her name.
crazy.
Hmm. And we just made space for it. And I, of course, would never, you know, I asked her, do you want to know? It's not something she needed to know, but she did want to know. And so we made space for that. And the left and right brain talked to each other, and it came right up in 30 seconds.
Wow. That's probably something she buried, not even knowing it.
Hmm. For sure. Yeah. And she could still see her face and still see everything, that had happened, but she didn't hold her name.
Probably holding a name to it made it more real. I don't know.
Hmm.
That's where my
Hmm.
mind goes.
Yeah, for sure.
So, do you see people from like all over, or do you try to stay within your own state since you do things virtually? How far
Yeah, I
can you
mean,
go?
I work with people sort of all over. I have, clients in, let's see, right now, Denmark, London. So there's not a ton of art overseas. So I'm happy to do that work. And then of course I'm in Maryland, so I see people in person, here in DC, Maryland, and Virginia as well.
Perfect. Yeah, just in case anybody wants to get a hold of you and wants to try this, because it sounds amazing. And I think everybody has something they want to get unstuck with.
Exactly. And if you are not in my neck of the woods, if you go to acceleratedresolutiontherapy.com, they have a provider, directory, and you can search by state and look for providers, where you are. It is not as well known as EMDR because EMDR has been around a lot longer, but we're growing, and part of what I think is really my joy and my responsibility is to let other therapists know that this is an amazing thing to add to your practice. It just gives you another tool in your tool belt, but frankly I think it's just a better tool, and you may not need some of the old ones.
Absolutely. If you're talking about one session, you can, depending on, how deep it goes, that is absolutely amazing. I think that's one thing that kind of holds people up is because they're like, oh, what do I got to come see you 8 to 12 times? And, then they start thinking, does my insurance cover this? And they go down that way. And instead of thinking about their healing, they're more thinking about the path that they have to take to get there.
Yeah, absolutely. And look, if I'm being honest, most talk therapy takes way longer than 8 to 12 sessions. So, this is not even close to that. And so it is a selling point. I also think though that it's a little bit of a drawback in that nobody believes that it's possible, because if we say therapy's hard work, it takes time and all of that, and then we come up with something and say 1 to 5 sessions, people don't believe it. And I understand that. I didn't really believe it until I tried it. And so I get that suspicion. It makes perfect sense to me. But at this point, I just tell people I want you in and out, because that is my greatest gift, is weirdly to not see people for very long or get to know them, which is the antithesis of what I love about talk therapy, which is developing the relationship and that sort of thing. But frankly, I do develop a relationship even in a few sessions, because there is something so connecting between me and a client who's healing. Obviously they're grateful. I mean, it would make sense if you are free of burdens that, you're sort of grateful to the person who's sitting in front of you, who's helping you to do that. But I get emotional. I really do. I get emotional seeing people heal, because I can feel the weight that is being lifted. It's palpable. It's in the room. As I said, I see it on their face, and there literally is no greater joy. My kids bring me greater joy. Other than my kids, I don't think much brings me greater joy than this.
I can totally see that. I think that would be almost like addicting, just to heal as many as you can, because it's beautiful and you know that you just set them on a path that they've wanted to be on for so
Yeah.
long.
Yeah. I do think it makes that the occasional person that it doesn't work for, because look, there is never going to be a treatment that works for every human being all the time. It's just not possible. We are dynamic, we are unique. So there are people that I don't find either are ready for art or are sort of maybe ready to let go of some of what's holding them back. And I will say, I do get quite disappointed when it doesn't work for someone because I'm so sure about it. And then I have to really say, look, you cannot heal everyone. That is not that's not how it goes. There are some people that, we can't help.
Yeah, but do you think maybe it's like they're not really open to it? They're not giving it everything?
Sometimes I think it's scary to change. I do find that people with things like chronic illness and chronic depression, and so, I had a guy in here with art, and I said, I feel like there's some resistance. He had really, 15-year depression. And he said, I don't know that I want to give this up because people would have expectations of me and they'd expect more from me. And when I'm depressed, people don't expect anything from me. So that was a very insightful man who could actually say that. Most people who come in and aren't getting better are not that insightful, and they say, why isn't this working for me? And in my mind, I may have some awareness, and I may say something like, I think change is really scary, and this just might not be the best time to do this. And I think, maybe you could try again another time. But I usually can tell I tell people to give it 3 sessions. And by the 3rd session, if they're not noticing changes, then I don't ask them to come back because I don't want to waste their money. It's not for them. And you can tell
Right.
quickly. So again, what is the worst that happens? You have 3 sessions, you tried something new, and you move on to something else. There's not really a huge downside because people don't feel worse except for that one person in 5 years, 6 years.
Hey, that's not a bad outcome, not a bad
Yeah,
percentage.
right. Yep.
I think that guy needs more talk therapy and maybe some self-esteem stuff.
Mhm. Yes.
Well, if somebody wants you specifically, what's the best way to get a hold of you?
Yeah, so they can find me at brookebralove.com, and I'm on Instagram, Brooke Bralove Psychotherapy. I'm also on Facebook, Brooke Bralove Psychotherapy, and TikTok, BB Psychotherapy. So, yeah, come find me. And again, I just want to give people hope. Try one of these brain body based therapies and try something different. Try a different way in to the places you're stuck. You do not have to have this with you for the rest of your life.
I love that. You don't have to be stuck where you are. There's different avenues. I mean, think about how many different modalities and everything that there is today. There's really no excuse to live in your own like demise. Like it's time to get out of it and live the life that you want. You deserve
Yeah,
it.
and I
No.
tell my clients all the time, I don't support your suffering. I won't sit here and watch you suffer and support that. I just won't. And I really believe in that.
And I think you're good for saying that because I mean, you want to live there, then yeah, don't waste your money or my time. Is
Yeah. Yeah.
there anything else that you wanted to add?
No, as I said, just encourage clients to try something new and therapists to add something that will bring a lot of sort of a reinvestment in your work and more enthusiasm for your work. And for a lot of us, especially after COVID, we're very burnt out. And so I think this is an incredible remedy for burnout for therapists.
Do you teach this by any chance?
No, so if you go, I mean, you can be a trainer. I am not a trainer because I really like working with clients. But there are, lots of amazing, wonderful trainers around the country. And there are 3 levels of training for art. But once you do the first basic level, you can start being an art practitioner the next day. So that's pretty exciting too.
Yeah, absolutely. Good. Just for in case anybody out there who is in the practice and is looking for new modalities to help with their clients.
Yep.
Well, thank you so much for being here. I really appreciate it. This was very informative and very interesting.
Good. Thank you, Tiffany, for having me.
Of course.